Stay tuned for home health news you can use, brought to you by Deer Valley Home Health Services, your leader in home health. This program gives you interesting information on timely topics related to home health and features a segment called Ask the Nurse, where you can call or email your questions and have them answered on air by one of Deer Valley's registered nurses. Now, here's home health news you can use, hosted by Carolyn Bryson, Marketing Director for Deer Valley Home Health.
Well, good morning and welcome to another broadcast of Deer Valley's Home Health News You Can Use. My name is Carolyn Bryson, and today we have such an informative program. I have some guests that I cannot wait for you to hear all about the information that they have. They are from an organization called Gateway to Hope, and it deals with women that have breast cancer. So we have on deck Jane Weiss. She's a registered nurse. She is the program nurse manager at Gateway to Hope. And we have Rick Rovak, and Rick is the interim executive director of the program. So Jane and Rick, thank you so very much for being here today.
Thank you for having us.
Thank you for having us.
I tell you, it's just a pleasure, and I found out about your organization quite by accident. I was having lunch with someone with Mrs. Taylor from Deer Valley, and also with Mike,
yep,
who is over at, I guess he owns the building that Deer Valley is in. So we were having lunch one day, and he just happened to mention about this organization that he was so passionate about and a part of. And I'm like, Gateway to Hope. And when he told me the things that you did, it was just awesome. And I said, I have to have them on the radio. And he said, well, now, it won't be me, but I'll get you in touch with somebody. And sure enough, he did. And Rick, you called me that day. And so I love it when a plan comes together. Mm-hmm. So before you all get started, I want to give out the number for the station. We do take text messages and call-ins because you may have questions that they can answer. If you are in our local St. Louis area, our number is 314-881-1695. Again, that's 881-1695. And if you are outside of our out of our local calling area, you can reach us at 1-800-313-KXEN. Again, that's 1-800-313-KXEN. Or if you don't want to try to figure out what goes with KXEN, it's 5936, 1-800-313-5936. You can call in and be a part of the program on air, or you can text and I can read their questions to you. So, again, we are appreciative of your being interactive. Call in, let Jane and Rick know what's on your mind. And in the meantime, I'm going to give them an opportunity just to tell us about this wonderful foundation.
Thank you. Just to say, Carolyn, we are deeply appreciative of this opportunity to have a chance to really spread the word and raise more awareness about this really important program in St. Louis that we've been a part of for over almost 11 years now. Just to tell you a little bit about what Gateway to Hope is, what our mission is, and to give you just some basic information. The mission of Gateway to Hope is really to provide comprehensive care and make sure that basic financial needs are met for individuals who are diagnosed with breast cancer or at high risk for developing breast cancer. Mm-hmm. So that is really the mission. We really are want to make sure that any individual who is diagnosed with breast cancer in our region, in our St. Louis region and beyond, is able to access the medical care that is needed for their breast cancer treatment, and is able to pay for the basic financial needs that they are going to incur as they go through this treatment process. So we don't want anybody to not get that treatment or to suffer from the financial burden that goes along with a breast cancer diagnosis. So we want to make sure that we can fill those needs by the services and the program that we offer.
Okay. And I noticed on your website that there are 3 particular ways that you assist people financially. Do you want to talk about those programs individually?
Just to back up a little bit, I'll give you just a real brief background about Gateway to Hope. It was started initially by 2 physicians who saw individuals in their practice who were diagnosed with breast cancer and came to them with late-stage breast cancer, and it was disturbing to them that these women were just coming with late-stage breast cancer merely because they had no way to access the care. They didn't have the resources. So they put together in the early years of Gateway to Hope a cadre of partners and providers who really donated the care, all the treatment necessary for breast cancer treatment. And as we've moved forward in the community and as the healthcare landscape has changed, and especially with the Affordable Care Act being implemented in 2010, we found that more people were able to access the medical care. However, because now they were mandated to have insurance. So in the early days, people were either uninsured or underinsured. As that changed with the healthcare, with the Affordable Care Act, people now had insurance. What we wanted to do is make sure that people were able to pay for that insurance. They were able to pay those premiums, which can often be very high and be very much of a financial burden. In many situations, people even lost jobs. They had COBRA, whatever the situation was. So one of the ways that we currently are able to help patients financially is through a program called IPP, which is our insurance premium program, which we implemented about a year ago, a little over a year ago. And we are now able to pay insurance premiums for people who qualify. We do have specific criteria that patients must meet, medical and financial criteria. But if they meet that criteria and we deem them eligible for Gateway to Hope, we can help them with their insurance premiums. So this is something that's relatively new, but it's been very helpful for patients because often they lose their jobs, they have to work part-time, so their income may be considerably less while they're undergoing treatment. Mm-hmm. So this is one way of helping. And in addition to that, we're able to assist with basic financial needs. And those, again, for patients who are eligible. And that is through a fund called Thelma's Gift, which was money that was very generously donated to Gateway to Hope, seed money, many years ago in the early days of Gateway to Hope, by a family who lost a loved one to cancer. And her name was Thelma Muskin, and they donated the seed money, and then that fund has since grown. So through that fund, we're able to offer assistance with basic financial needs, and those consist of things such as rent, mortgage, utilities, transportation assistance. We can pay for lymphedema garments now. We can pay for some prescription medication related to breast cancer. So it really, car payments, car insurance, it really helps patients to take off some of the financial burden, as I said, while they're undergoing treatment. Maybe they've lost their income, they're maybe lost their job, couldn't work because of their treatment. So it's extremely helpful for patients in that regard. So those are the basic funds that we have now that are able to assist patients throughout this process. So
that's remarkable.
Yeah,
it really is. So when people have a need, then they would. Actually, I went on your website and I saw that it was quite easy to navigate, and it looked like all someone had to do in terms of contacting you was just giving their name, telephone number, email address, and write a simple message about what they were going through. And then someone from the office would call them back and set up an appointment for them to come in.
Exactly. What happens is, I'm glad to know that the website is easy to navigate. That's important. We want patients to, most important, anybody who thinks they might be able to benefit from assistance, or they're undergoing breast cancer treatment and they're struggling financially or even emotionally, we want them to be able to find us and make sure that they can find us, and then we will then put them through the intake process. They can either access it through the website, which is gthstl.org, or they can access it through our phone. Simply call our office, 314-569-1113. Anybody, again, who thinks they may be able to benefit, they may be eligible, we would like them to call and not to hesitate. So, yes, once a patient does either initiate that communication through the internet or make a phone call, we would then call them back, and we try to call patients back within 24 hours, and we would go through just kind of some brief questions about their situation. You do have to have a confirmed diagnosis diagnosis of breast cancer in order to qualify. And you also have to meet specific financial guidelines, which is up to, we assist patients up to 400 who are at up to 450% of the federal poverty guideline. So we would then ask some simple basic questions, and if we, basically the staff that does the intake is our clinical staff, which consists of 2 nurses and a social worker, and we would put them through, we would kind of assess just some of the basic information about where they are. If they're undergoing active treatment, that's another important criteria, which we consider active treatment, chemotherapy, radiation therapy, or surgery. So we would, if we think that they do look like they're going to qualify, then we would put them through our actual intake process, which is an application form that we can do over the phone. And we ask them the simple questions. It takes about 10 or 15 minutes, just get medical and financial information. Then we would schedule an appointment. If we do think that these patients look like they will be eligible for our assistance, we determine in conversation with the patient, we explain what kind of assistance we offer, and then we kind of think about their each individual situation and talk to them about what they think would be most helpful to them to relieve some of the burden for them as they're going through this process. So once we get their information on the phone, then we would make an appointment for them to come into the office, and there are some documentation that we do require, and they would come in and we would ask them to bring that with them. We would meet them. We like to meet our patients so that we can connect a face with a name. We really try to not just say we're going to write you a check and help you with your insurance premiums or help you with your, paying your utilities, but we really want to develop a relationship with our patients. It's important to us to really connect with them, to let them know that we are there for them during this journey, this cancer treatment journey, because it's not just about the finances, but women who are undergoing, or men who are undergoing breast cancer treatment who've been diagnosed, there's a tremendous fear that goes along with it. It's frightening. They're often the breadwinners of the family. They may have small children or teenage children, and there's a lot of factors that are going to impact their emotional state while they're going through this, and we want to be able to be there to help them go through that process and refer them to outside resources. That is another big part of what we do.
I noticed that on the website that you had a section called Community Resources, so that even if you were not able to help, then you had a long list of organizations that are involved in the treatment of breast cancer, and also housing and basic necessity of living.
Right. And thank you. That is also an important part of what we do. So that comes into play a couple ways. First, if we have a patient that calls and they don't meet our requirements, maybe they don't have a diagnosis of breast cancer or they're not undergoing active treatment, that they are struggling, we have a list of community resources. We always make sure that we refer patients to a community resource. We give them names, we give them phone numbers. We don't want to leave people hanging and say, I'm sorry, we can't help you. We always try to connect them with a resource to assist them. We probably assisted patients or people over the 11 years that we've been open. I would say probably 1,200 or more patients who've been referred out who didn't necessarily qualify for our program. So that's an important part of what we do. In addition to that, if patients, come to us and maybe they meet that financial maximum limit of what we're able to do, and then they still need assistance, we will try to find resources in the community to just what you said, to help with housing or to help with utilities. There are some very good resources in our community that can also meet those needs. So, yeah.
All right. Now, I also noticed on the website that you have a lot of events coming up. 2 in particular that seem to be annual events. The one, because the names for everything that you have is just really catchy. Like there's the Breast Trivia Night Ever, which is, I think, Saturday, April.
I believe it's April 9th.
April 9th.
Yeah.
And that's at on Broadway or off Broadway?
I'm not sure. No, I can speak to the idea. That was actually came to us as a third-party event, which we are fortunate to be the beneficiary of third-party events all year long.
Okay.
So this involves an organization who says we want to raise money and then turn the money over to Gateway to Hope. And so we're very fortunate there.
Okay, and you know what? And I made a mistake on that name. It's called Beyond Broadway. That's the
Okay. Oh,
location
thank
of
you.
the event, and it involves, of course, trivia. There's
Yep.
a silent auction, dinner and drinks, and you will be spreading hope and granting wishes.
Yes.
I like that slogan. And then on Saturday, May 7th, there's an event called the 7th Annual Laughter and Lyrics for Life, and that takes place at the pageant.
Right.
Very popular location in the Loop at 8 p.m. It's a battle of the bands.
It is. What we've been doing is we've had this event, I think this is our 6th year, but what we do is one year is a battle of the bands, and the other year is a comedy contest. So this year is the battle. That's why it's called Laughter and Lyrics
And
for
lyrics,
Life.
okay.
So this year will be a battle of the bands. We're very excited about it. 3 local bands that the people in town seem to love. So it'll be a great night.
Okay, and I see the tickets are $50 in advance and include beer and wine.
Yeah. And they can call the office. They can go and get tickets on Ticketmaster or call our office directly, and we can take care of it there.
Okay. All right. Now you have some serious donors, huge companies that contribute to you.
Do
Do you want to just mention a few?
Well, we're very fortunate enough, and there'd be no way to go through that whole list, but we've been very fortunate that the community has engaged with us to support the cause. And that's how we were able to start the insurance premium program, so that, as Jane explained, when we had to move into this insurance premium program with the Affordable Care Act, the support from the community has been wonderful. And then we have great individual donors who help support us for both insurance premium, but more importantly, they're individuals and companies in town who have come to us to help with Thelma's Gift, because this financial aid is so important. I read probably now maybe a year or two ago the term financial toxicity, which really accompanies, in many cases, accompanies having breast cancer, is this problem of the added pressure and stress of not being able to pay for bills. And we really want to take as much stress out of the situation as we can so that she can just concentrate on getting better.
Right. I saw on the website a lady named Janice. I think she was 60 and had been downsized out of her job. And so after becoming jobless and without insurance, 2 months later she was diagnosed with breast cancer. And she was saying that when there's zero income, even a $7 prescription might as well cost $100. And that's where the funding that you provide is just so monumental.
It's really, yes, it's so meaningful to patients. I think that many of the people that call our office, are people who have been very self-sufficient. They've had their jobs. They've been hardworking. They've made ends meet. They've supported their families. And then they get a diagnosis of breast cancer, and all of a sudden they have huge out-of-pocket expenses and deductibles, and they're not able to work, and their income goes down. So they're not people that are used to asking for help, and it's very hard for them sometimes to make that initial phone call. But we want them to know that that's why we're here, and that's why we are so fortunate to have incredible, generous donors in this community. And then get them through that process and support them through financially, help them with their basic needs and their insurance, and then get them to the other side. And it's so gratifying to see patients who come in really down and depressed and scared, and they see that there's an organization that will help them. They certainly have support from their physicians, wonderful physicians in our community, and then together as a team we all get them through this process and to the other side where they can restore their health, get back to their lives as they knew it, and then they turn around often and say to us, what can we do? I want to do something to help you. We have patients say that often, and it's and we're just always so touched by that, because that's certainly not why we're here, but I think telling a story for someone who tells their personal story and is willing to share that probably means so much, because that's really what it's about, is the personal stories and seeing people go through this.
Exactly. So, because it's one thing to donate money. Excuse me. One thing to donate money, something else to work on it from the fundraising side and having events and so forth. But when you see the bottom line, and in this case it not being financial, but the just the spirits lifted,
Yes.
the lives that are transformed.
Yes.
Because even, some of the stories that I was reading as I was preparing for the interview, the ladies were, they all had totally different situations, different age groups. For example, one lady was a young mother who had just had a baby. She had a beautiful young girl, and then, just a few weeks later, she was diagnosed with breast cancer herself and was devastated because her mother had just passed from breast cancer.
Yes.
And so,
so many stories like
right.
that.
And so she got help from you, and now she's volunteering, and she's, it's just wonderful, the personal touches. I was reading a press release, and it says that, this was when Marty Moore became president of the board, and Even Goldfarb was vice president. Mm-hmm. And it said that they are committed to seeing Gateway to Hope purposely grow and save more patients' lives. The organization provides a lifeline to breast cancer patients and helps ease their financial and emotional burdens so they can focus on healing. Exactly. And I thought, that's just it in a nutshell. Mm-hmm. They are providing a lifeline. What you're doing is just awesome. Providing a lifeline to breast cancer patients and helps ease their financial and emotional burdens so they can focus on healing.
You can really see, I think, on people's faces when they come into the office, or you can hear it in their voices, the despair that they feel when they first make those phone calls, and they're frightened. And then they come into the office, and I think they leave after, meeting with us and hearing, we're going to pay their Ameren bill, or we're going to pay their Leclerc gas bill, or help them with their, $150 insurance premium, or whatever it is. And they leave and they hug you, and you can just tell that they feel that they're being taken care of, that somebody cares enough to really help them, and they're so thankful. And it's very satisfying. I mean, I recently had a patient who was, a young woman. She was about 49, and she had just recently been diagnosed with a recurrent, unfortunately, stage 4 breast cancer, which we're seeing more and more of. And she has 3 children, 3 teenage boys. She's a single parent. She's working, but she's having to cut back on her hours because she's having difficulty with the treatment. And, she said to me, I'm not sure that I can put food on the table to feed my 3 teenage boys now that I can't work. And, she was so frightened. So, we connected her. First of all, we'll be paying her insurance premium, which I think was a big relief for her, because one thing that's so important to patients is that they can maintain that health insurance, because that is part of the lifeline, I think, making sure that they're going to be able to meet that need. And then we also helped her with, we referred her to other places for food sources, and, we'll be helping her with utilities. And I think she was sort of, just in disbelief that there was someone who really was going to be able to do that for her. And she was so thankful and so appreciative. And, that's just one of many, many stories. Each one is a little bit different, but we just see that, and hopefully we'll get her through this and get her on the other side.
And Carolyn, I think the key here is to know that when we say we'll pay for the insurance and pay some financial assistance, that loosens up any money that the patient does have for other purposes that they need. So it's not just paying for something, but it lets them use the dollars that they do have productively. And I have said 2 things, just to go back when you were talking and saying in the St. Louis area for Gateway to Hope. I want to be very clear. We take care of people through Southern Illinois and into rural Missouri. So it's not just right around here. So people who are listening to this, if you can hear us, the odds are we can help you. So it's very important to know. So it's a great area. And
Missouri and Illinois.
Yeah, and the beauty there is, and I don't remember if it was Jane's patient or whomever, but as an example, we got insurance for the patient, or paid for the insurance, but the person didn't have enough money left to put gas in the car to get to the doctor's appointment. So being able to help with a gas card or something, I always call it the weak link theory. And, everything has to fall together like a chain of strong links, and that's what we're really able to do. And just to point out one other thing, because Jane's been talking about, Jane has been here for all 11 years, and I believe when you hear I was on the board I've been on the board for about 6 years. I was president for 3.5 years, and then took over this interim executive director. To be in the office now and to hear what goes on and the compassion. So that compassion is so important to the patients, and it shouldn't be understated, because that's part of the healing is somebody knowing they have somebody who's there for them.
Right. I tell you, you guys are just doing an amazing job. And so, and Jane, you've been with the organization since day one. Rick, interim executive director. That's, I noticed on the website, people call your organization a guardian angel. Just an angel of light. You're easing burdens and transforming lives. I want to give that number again, because I think we have about a minute and a half or so left in the program. It's 314-569-1113. 314-569-1113. And then the website is GTHSTL.org. And of course, the GTH is Gateway to Hope, STL.org. All right. So, if any of you, okay, 1 minute left. All right. So I'm sure that our listeners have found this beneficial. So if you have heard something, you know someone with breast cancer, you have breast cancer, you're wondering, am I eligible? Sounds like a wonderful program. Call them, 314-569-1113, or visit them on the website, gthstl.org. Jane and Rick, Jane Weiss, Rick Rovak, thank you. God bless you. We appreciate so much the work that you're doing in making lives so much better and just in easing the burdens. It's a lifeline, and you are a blessing to all the people that you come in contact with. And I just hope that, just pray that your work continues to grow and your success abounds.
Thank you for having us.
Thank you so
You are
much.
so welcome. This has been Carolyn Bryson from Deer Valley Home Health Services, wishing you a blessed and productive week.
You've been listening to Home Health News You Can Use, brought to you by Deer Valley Home Health Services, your leader in home health. They are located at 8600 Airport Road, Suite 104 in Berkeley, Missouri. You can contact them by phone at 314-355-3679 or by email at deervalley@sbcglobal.net. And be sure to check out their website at www.deervalleyhomehealth.com. Thank you for listening, and join them again next week for more home health news you can use.